A brief update. Can you tell us how we're doing? I think your other video is actually on the website, so.
I'll have to look.
Yeah.
Yes, I had surgery. It'll be 5 weeks out this coming Thursday. I had no complications. Everything went perfect. 4 hours after surgery, I was up walking for an hour and 10 minutes. I work at the hospital here, so I had to go visit everybody 4 or 5 times a night.
Yeah, I was in the ER. They said you were down at the ER and
Yeah.
walking around.
Yeah, and it's nice. You know, everybody takes great care of you here. Take your pain medication after your walk. Makes you feel real good and you relax. You know, Dilaudid's a good thing.
This is
yeah.
like the opposite of most videos. You know, kids don't do drugs.
Don't
We have Lewis saying here, do Dilaudid. Is that right?
Well, the nurse will come and tell you, yeah, doctor recommends it. You need to take it. It really does. You're going to have, you know, a little dull pain because of your nerve in there, but it was great. No problems, no vomiting, no complications, no side effects. Follow the book, follow the diet, the 3 stages.
And you had a little something where you ate a little too fast or something. Did I hear from Trish? Or
Well,
can you educate everybody that might help them if you had a little experience to pass on? Or
we bought a halibut steak, and one night I was eating part of it. It was like a 3-day meal, or meals for 3 days. And I was chewing and chewing, and it didn't go down. And I was walking around the house for 40 minutes going, oh God, and I'm praying, please, because I hate to vomit.
But you felt like you needed to.
Oh, I finally called a friend of mine who had the surgery, and he said, go and vomit. And so
I'm not sure this is going to be on the website.
I did the last part.
I don't know.
No.
The part where he had surgery, he's back working already?
We might have to. We're going to edit this out. Here's Lewis, and thank you very much.
No, you all need to know this. I chewed and chewed and chewed, and it was like a tough piece of chicken. It just wouldn't go down. It was kind of dry. But it was a small piece, and I thought it would. And it feels like a knot here, and you feel like pressure in your chest. And I mean, you're praying because it hurts. And sorry, this will be edited. I heaved 4 times, and I got some liquid up, and not anything chunky. And then right after the 4th time, I was great. I said, okay. And I have not had any. That was the only problem.
So the educational point here is, in the early phases after surgery, a hard or a pretty solid piece of meat or something like that. Sometimes, and even usually whitefish and halibut are pretty good. But like you say, if it's a pretty solid piece, depending on how you cook it, it might not be the perfect choice.
Right, it wasn't. Like a flakier, softer whitefish, like a walleye or bass is even really soft. Chilean sea bass is great. Just follow the book. A lot of my litter mates are getting on the internet, and we're all emailing each other, and they're all emailing saying, well, I'm not losing the weight like I thought I would, and I'm hungry, I want pizza after a week. You know, you got to do what the man says, because he's giving you a second chance at life, and there's no more chances. If you do like he says, the weight will fall off, and you'll lose. I don't sleep with a CPAP machine anymore. I gave it away. I don't have diabetes or hypertension.
Can I interrupt about
Sure.
that? Now, you gave away your CPAP machine?
Well,
now you know what that's for, right? It means at night you stop breathing and your oxygen goes down. Did you have a sleep study that says that your oxygen is now okay?
I actually failed to fail my sleep study, and they wouldn't put me on a CPAP. So being a respiratory therapist, I have all kind of connections. I got a CPAP machine.
Oh, okay.
And I know what I'm doing. I set my pressure, and I set it until I got it right where I was asleep at night. But I didn't wear it all the time. There was a lot of nights that I maybe didn't have an episode. Because I know when I wake up in the morning, if I got drool in my beard and that, I know that I had a rough night. And if I have a headache, I know I didn't sleep. And if I have no energy, I know I didn't sleep. I'm dreaming now. This guy in my life, and everybody that has this surgery will say the same thing. I watched him do 2 surgeries. I never seen anything, any internal surgery that was so clean. No blood, quick, to the point. He's fantastic. Yes,
I
sir.
think we should stop on that.
Yeah.
I think we should- I'm sorry, no more questions. I think we'll edit out the vomiting part and leave the fantastic part.
Did you say you've lost 43 pounds in 5 weeks?
I started a soup and salad diet the week before because that's what he recommends, so that you don't stretch out your intestines. It makes for a cleaner, better surgery, more successful surgery. If you eat a big heavy meal and that stretches and then later on it goes back, it's constantly moving and doing that stuff. So I probably lost 8 to 10 pounds maybe the week before. But I know I weighed 328. The scale weighs my mother exact every day. I'm down to 285.
Any questions we should answer? Anything that you're not clear about that we ought to go over? Anything that's up in the air still, or?
No, I just came to. I know there's a 1 month follow up.
Yeah.
And I just,
Well, that's one of the things, is see if there's any questions, or if you're not clear about the vitamins or the supplements or anything like that.
I'm doing a multivitamin from Sam's 3 times a day. I'm doing the Actigol twice a day. I'm doing 40 of Prilosec once a day. Pepto. My Tums I'm not real good about. I carry them with me, but sometimes I forget them. But I'm not having any.
Right, the Tums are that's a good question, maybe we can comment on. The Tums are for lifetime. You don't need anything urgently, so missing a dose is no big deal. But for the rest of your life, one of the things we know is that you face a risk of osteoporosis. In fact, all of us in America, I'm sure you see on the advertisements and TV, and you see in the patients you take care of with hip fractures and loss of height in the spine and things like that, osteoporosis is a big problem in the United States. So there's a general agreement that a little extra calcium is good. The hot new area of research actually in osteoporosis that's maybe worth commenting on if you haven't seen this is that a lot of calcium supplementation in people might not be as useful as we thought. Some is good, so the lifetime of extra Tums is good, so keep it with you and take some. But the most important thing might not be the extra calcium, it might be vitamin D. 10, 20, 30 years ago, attaining a serum vitamin D level was just a research kind of goal. It wasn't easily available like sodium and potassium. Now that vitamin D is easily available, they have some very large-scale studies that show that lots of us in the United States and around the world are tremendously vitamin D deficient, even without having a surgery. And low vitamin D then, of course, leads to bone loss. So probably the best thing to do is to keep up on your vitamin D. Now, you mentioned that you're taking 3 of the Walmart vitamins.
3 of
One vitamin usually contains, on average, the usual multivitamin contains 400 units of vitamin D. The hottest new research out on vitamin D suggests that maybe we all want to go up to 1,200 units, and you're already there.
Okay.
So you'll want to pay attention to that. And again, the Tums is something that lets me tell you, and a reminder to everybody, that your supplements post-op are not very important in the first weeks. It's really a marathon, not a sprint. So the calcium and the Tums are important, not that you got one yesterday, or that you missed a dose at 4 o'clock that you should have had, but that you take some additional Tums for the rest of your life. And the other common thing that people do is they say, oh, I'm taking Caltrate or something else, calcium, instead of the Tums. And we don't want you to do that. The reason is because calcium in Tums acts as an antacid. So it's a